I think this is the most important podcast I have created for you, the healthcare provider, for you, the physician, more than anything else. And here's why: you are needed. That reason that the majority of you went to medical school, that chance to help and make a difference, you have that great opportunity to do that now. And that is what I'm going to talk about today in this podcast. I want to explain how the election may affect some patients who are transgender, who are non binary, who are their family members, who are the people that love them. How it may, and I say may because there's no always and nevers. And remember that I myself do not speak for the community. I'm going to share with you the things that I am hearing and the common questions that I am hearing. After we talk about those common questions, I'm going to talk about ways not to respond. And this is not a cheat sheet of like memorize these things. I'll explain why not to respond that way and some things I would consider doing to be that provider to help out. All right. Why this election has such a profound effect is a multitude of reasons. We have heard and we know about all the money spent on the anti transgender ads that occurred for this election. It was a lot of money, and it was hard to turn on the TV without seeing an anti trans ad. So, right away, used as a topic to divide people, used as a topic to motivate people to vote for Republicans. So dehumanizing is what these ads really did. Dehumanizing transgender and non-binary people, making fun of the pronouns, of referring to people as what they were assigned at birth. There is that. And then after the election, as discussions are going on of why this was lost, why Republicans won and Democrats did not, there's often a conversation from all sides about the fact fighting for civil rights was a problem. Now, that's not the way that it is tabled. It's usually tabled as focusing on pronouns or focusing on gender fluidity. And so, what that demonstrates to me as people are blaming the fight for civil rights, the fight for human rights of transgender, non binary people, because that's what that was, and instead of recognizing that this was an issue of civil rights, it is being focused on pronouns. It is being focused on a lot of incorrect information about how gender is handled in schools and why, and how gender is handled in medicine. And so not only was the community attacked up into the election, now they're being blamed for the results of the election. Now, that's simplifying it. Yes, there are many other factors. I don't deny that many other things being discussed, but I have yet to hear a discussion of why the election turned out the way it did without gender being mentioned. I want to share with you, I think, the three most common questions. And I think as providers, it's really important to know these because then we can understand what is happening as our patients and their loved ones are coming in. So, the first question I hear the most is, will I be safe? I'm bringing in family members because, especially those that have family members who are transgender, who are non binary, who still live at home with them, there is more of a responsibility from the parents and guardians. There is a more involved relationship from the siblings. In fact, the idea of safety, and I'll get a little bit into why that's such a question, but the idea of safety is so obvious to anyone that has any relationship to the community. This was greatly demonstrated when I was talking to a teenager who has a sibling who is transgender. And when asked about the results of the election, he admitted he was worried. And when asked what he was worried about, he said, I'm worried for the safety of my sibling. The reason safety is an issue, we know violence goes up anytime there's any legislation around transgender people, but this is more than that. Because there was such a focus and because there was such a message by the group that won of being very against the community, that is the way the ads spoke. By referring to people as what they were assigned at birth, it emboldens people to do more that's against the community, to be violent against the community, to not affirm them, to deny their identities, to bully, to make jokes, all of those things which lead to a lack of safety physically, emotionally, and otherwise. So it makes sense that people might be asking, am I going to be safe? If the leadership used us and spoke against us as part of their political campaign, are people going to feel emboldened to do the same? Now, this isn't a matter of whether that's right thinking or whether that's wrong thinking, because it doesn't matter what our opinions are on whether that's right or wrong. That is the thinking. That is what I'm hearing. I'm not bringing it up for debate of whether it's right or wrong. It is what I'm hearing. And that's what it's important for us to know, because it doesn't matter what we think. It matters what our patients think. So if our patients feel they may not be safe, that is important for us to know, because if we think of Maslow's hierarchy, it's going to be very hard to address other issues if there is a lack of sense of safety. That is the base thing that people need to feel before they can take care of other parts of themselves, including their health. The second most common question I'm hearing is, will my identity be respected? Will I be affirmed? Meaning, will people use my name? Will people use my pronouns when I go to work, when I go to school? Again, it goes back to people feeling emboldened to deny, to not respect it. And what is that going to be like to go to work, to go to school, if people aren't respecting it? There's a concern whether they are in an institution that is going to support their identity. They don't know. That's scary. Are people going to use our name? Are people going to use our pronouns? Now, if you're listening to this, you're probably like, we've got this. We've been doing it. We're not going to change. The community knows. Our patients know. I want to tell you that as a group of medicine, we have made progress, but we are not doing great before this when it comes to names and pronouns. And I'll do another podcast about that. But let me tell you some stories. This happened on the East Coast in a very liberal area. A patient went into the ER with their parent, and the parent explained to the nurse in the ER that their child uses this name because they're transgender. If they could please use that name. And the nurse looked at them and then yelled across the ER, because it's usually a big room, yelled across the ER the patient's legal name, not the name they just were asked to use. That was intentional. This is not a rare story. And I'm just giving you one example. And yes, it was a while ago. It's less common to hear now. But let me tell you the story we hear now. The story we hear now is patients are asked, what name would you like for us to use to refer to you? They fill it out, whether it's on the computer or on paper. And I even had a story recently of a parent coming in to a healthcare facility and checking in and saying, hi, you're going to see a different name on your chart, but this is the name my child wants to use. And they were so busy looking. I really don't think this one was intentional, but they were so busy looking at their computer screen that, oh, here it is, and then use that child's legal name. We are not doing great at names and pronouns, and now people are more afraid that they aren't going to be affirmed. So you may think your institution does great, and maybe it does, but does everybody that patient comes in contact with, is everybody doing well? And you'll hear me refer back to this as we talk about what you can do. But I want you to think about this. I want you to remember this. As patients come in, as their family members come in with them, this is something they're afraid of. And what has there been their experience before they get into that examining room? The third most common question I hear is, will I be able to receive gender affirming care? President Trump has made many comments along the campaign of getting rid of all gender affirming care for any minors. So families are worried. He's even talked about making it difficult for adults to get gender affirming care. So people are worried. This medication, for those that need it, not everyone needs it, but many do. This medication is life saving. So the idea of not having it is very concerning. It goes back to that Maslow's hierarchy of safety. This is an issue of personal safety. So I want to talk about if these issues are brought up in your examining room while you're talking to patients in a hospital, wherever you meet with patients. I want to talk about ways I see people respond that do more harm than good. And I'm going to talk about why it's not good and why I often see people do this so that you can center yourself in to be the provider you want to be. So what I mean is sometimes when people are brought these concerns, these worries, and this is not just healthcare providers, this is to family members and friends and everyone, right? When we're brought these concerns and worries, there is a desire to look at the bright side, to point it out, as if that's going to make the person feel better as if they don't already know that. Like, oh, if they only just knew, Sarah McBride just got elected to the US Congress. She's the first openly transgender person elected to Congress. Side note, if you have never read her book, Tomorrow Will Be Different, I highly recommend it. It's a wonderful book. That aside, yes, that is great. It's groundbreaking. But when somebody is upset and expressing their concerns and expressing their worries, and our response is, hey, look at the bright side, it often invalidates what they've just shared with you, what they are feeling. Now, there's not always a nevers. It's all about how it's done and why it's done and knowing your patient and knowing the dynamics between your two. But I want to offer you that where it becomes invalidating is many times people do this, point out the bright side when they are uncomfortable. The person that points out, the provider, when we're uncomfortable, when we want them to feel better, when we don't feel comfortable that they're scared or they're worried, and we just want them to feel better because then we'll feel more comfortable. That's when it goes bad. That's when it becomes invalidating. You don't have to make anyone feel better. Again, you know the dynamics. There's no always and nevers. But if your motivation is to make them feel better because you want to feel better, because you're uncomfortable, instead of thinking about making them feel better, which is your motivation, think about what it is that they need. I would offer they probably need to feel heard, validated, given space, all things to consider. The other thing that kind of goes along with this, instead of giving the bright side, is dismissing people's concerns, right? Someone says, I'm afraid I'm going to lose my hormones. I'm afraid I'm going to lose gender affirming care. Oh, that'll never happen. That can't happen. Because of X, Y, and Z, that can't happen. Again, they're not always in numbers. Sometimes explaining to people why you think that's unlikely to happen is helpful. Maybe they don't know how decision making works, but we have to be careful how we do it. That complete dismissal of like, oh, that's foolish. That doesn't feel good. That's the part that doesn't feel good. Oh, that'll never happen. Like, that's the dumbest thing I've ever heard. What's different is if you're coming from, let me give you some information you might not have about how this works, right? That's different. That is totally makes sense why you might think that. There are things that have been said that would make you believe that. As of right now, we will continue to provide gender affirming care, whatever it is, but that's coming from giving information. So again, it's noticing when you're responding, where's that coming from, right? So pointing out the bright side, dismissing people's concerns. And the third one I would say is just not addressing it at all. Someone gives you the concerns and you go, okay, so you're here today because of we just like Let them speak. Don't even give a nod of acknowledgement. Don't even give any emotion. Just jump right over that to why we're here today. So, those I think are the three biggest mistakes I would see. Pointing out the sunny side, but with that motivation that you feel better, dismissing people's concerns because you just think they're ridiculous and that's not possible. And the third one is just ignoring it altogether. Again, I think all of them come from a sense of discomfort on how the other person's feeling. Ignoring, like, let's just, okay, I'm just going to not acknowledge that so we can get past that because I'm uncomfortable. All of it comes from discomfort. So, what can you do? We talked a little bit about holding space, about acknowledging how someone's feeling, validating how someone's feeling. And so that's a big part of it is listening to the concerns, seeing what is needed, reassuring the role you are going to play in their care, the role you are going to play if you're going to advocate for gender affirming care. Even if you're a provider that doesn't provide gender affirming care, you can still provide reassurance. No matter what happens out there, I will always treat you with the utmost respect. My number one priority is to give you the best care. I see you, and we will continue to work together to help you obtain the best health you can have. No politician, no politics comes in here between our relationship and me helping you. My only focus in this examining room is your healthcare, your best interest. And we figure that out together, and nothing's going to change that. That's what I'm talking about. Reassurance. The second thing I think we need to do is continue training. We have to continue developing our understanding of what gender is, the biology behind gender, because gender identity is another part of biodiversity, okay? There is biology behind it, and that's our expertise. So continue the training to understand the biology behind gender diversity, to understand what is gender affirming care, why is it used, who is it used on, how does it work? Continue the training of letting go of those beliefs that a lot of us grew up with that get in the way of us being able to separate gender from biological sex, to separate gender from gender expression, from doing those things that sometimes mess us up in our language. And if you mess up with your language, it's not the end of the world. And we need to keep working on developing our understanding and doing better. So continue the training of yourself, of your staff to understand gender. This sounds like it takes a ton of time. It actually does not take a lot of time. You can have people like me come in and give talks and consult and see what some of the things you can do as a department or even as a provider, as an individual, to provide that inclusive care for everybody. I can do an audit of your business. If it's not me, somebody. But it doesn't take that much time. I often tell people that it takes a few minutes, a few times a week, or it depends on how you're getting the help. Are you doing it yourself? Are you bringing someone in? It doesn't take a lot of time, but it does take some time. It does take looking at it, evaluating, reevaluating, seeing where things can be better, seeing where people need help. The third thing I want to offer is to work with your administration, work with your staff. So if we look at administration, we want to talk to our administration. Hey, it is really important for me as a provider in this institution, for us as providers, for our patients, that we provide a statement. What are we doing to demonstrate that nothing's changing here? We still uphold the standard of care. We still uphold the respect of our patient, that mission you have as an institution to provide the care for all patients. How are you going to express that to transgender and non-binary patients and their families who are worried that their care is going to change? Talk to your administrators about what you can do, what messages should you release, what are their options, but also work with your staff. As I've mentioned, A patient's experience is not just with you, it's everybody they meet along the way. And so continuing to look and make sure everyone's trained and everyone's understanding. And for people that don't understand or people that feel uncomfortable about names and pronouns and gender diversity, giving them a place, a safe place where they don't have to worry about their job, that they can ask questions, that they can be trained, that they can have a conversation to come to the understanding that is the mission of that institution that they are working for. All of that needs to be done and looking and auditing your business, seeing where it may not be inclusive, what you can do better. As I mentioned before, this is one of my most important podcasts because now more than ever is the time. If you have been waiting, if you have been thinking, oh, one of these times I'm going to make some time to learn more about gender, I'm going to figure out how to be a more inclusive provider, or I'm going to figure out how to make my practice more inclusive, please don't wait anymore. We need you. We need you now to be the provider that you strive to be. That inclusive provider that treats people with respect. We need you. We need you to listen. We need you to reassure. We need you to validate. We need you to work together as a team with every part of your staff and your administration to communicate and let all patients know that they will be treated with kindness and respect that they deserve because reassurance matters.